Welcome to the Health Matters podcast. I'm your host, Kareem Amiri. Knowing the priorities of employers we serve is key to our business. We gather the feedback from employers through conversations about their priorities and goals. And in addition, we look at trends our data shows, as well as look at third-party studies to validate the work that we share. I'm really happy to welcome back two veterans of the podcast. They provide great insight. Dean Gilkes, Director of Group Sales and Retention, better known as my boss.
Thank you, Kareem.
You're welcome. And Nick Waters, Segment Strategy Manager, also known as my favorite Chiefs fan. Go Birds.
Thanks, Kareem.
To talk about those trends and priorities for large group employers in 2025. So with that, and once again, thanks again for joining me. Last year we came together and we talked about a similar topic or these, priorities. And at a high level, is there anything that might be new or that we didn't address in 2024 that you want to bring up today?
I don't know that there's anything new. I think it's more of the same, but with maybe some heightened sensitivity to certain things.
Yeah, definitely.
Yeah, I would lean into really all of the trends we saw last year accelerating here early in 2025. So certainly mental health care access, certainly as we look at cancer programs and availability of those and the concerns around rising cancer rates. And I think groups, as they look to address affordability, looking at how they can do that by reassessing the vendor partnerships they have to make sure that they can reduce those costs while improving the member experience. There continues to be a heightened focus around improved member experience.
Yep, definitely.
Kareem, let me ask you, because the podcast is not your day job.
Yes, I think people know that.
You're actually out talking to employers and consultants quite a bit.
Yep.
What are you hearing out there?
Yeah, I would echo a lot of the same things you just mentioned, but like really specifically, three things come to mind right away. First being, I don't think you can have a conversation without GLP-1s entering that conversation. Weight loss, what are ways they can try and do that affordably? There's lots of things that are discussed there. It can dominate a conversation. The second is pharmacy. Obviously GLP-1s are a subset of that, but in general, what are strategies that can be done? How can, as you mentioned, affordability, how can you make it more affordable or slow the rate or the trend of pharmacy there? And then the last is, it's around affordability, but how can, we keep costs down but keep benefits the same, especially as we see large claims begin to increase again. Actually, a little bit from the pandemic, it seemed like there was a little bit of a dip, and we're now reaching levels that were there around the pandemic or just before the pandemic, and now starting to surpass those levels. So it's really how can we keep it down, but not really take away benefits. I think those are the three things that come to mind right away.
Interesting. I'm going to keep you in the hot seat.
Oh no.
I'm gonna steal the hosting.
Okay. You're the boss.
And let's drill into some of those points. Affordability, first and foremost, right? What are you hearing, Nick? What are studies saying, and how can we help employers?
Yeah, and I think the first thing we've seen is around just what percentage of healthcare dollars are being spent on pharmacy. So specifically, on the heels of the pandemic. So nationally, we look at a lot of information from Business Group on Health, as you know. And nationally, we see the percentage of healthcare dollars spent was usually in that low 20s, right? But since 2021, we've seen it jump from 21% up to the end of last year, 27%. So nearing a third of total health care dollars being spent on pharmacy. So I think what's important to know about that is Wellmark's trend for pharmacy is less than that, so that's good because of the relationships that we have. We also have things in place like the biosimilar strategy, and I think that has passed along true savings to our groups. But nationally, this continues. I think this is a trend that it will continue to speed up. Actually.
Yeah, the biosimilars have been huge, and that's been a big topic of conversation with the clients that I've been with, and I've seen negative trends for them on their pharmacy spend, quite honestly, in the last year or two because of that. And we're just launching a new biosimilar for Stelara, so really excited to see how that plays out over the next year, and hopefully continues that positive trend in that direction. But yeah, there's definitely gene therapies on the horizon that are get people worried and that sort of thing. So pharmacy is definitely a big topic, and some of the strategies that we can bring there have been working.
Yeah. GLPs, again, I've been to a couple of different conferences, and where there's workshops talking about GLPs, they're the most highly attended. Folks think there's an affordability problem. The drugs are expensive, and they also want limits on availability to folks, to make sure that folks are really committed, and that there's long-term efficacy with the drugs. There's a lot going on there.
Yeah, and we've seen conversations when it gets to there around, are there programs that you can partner with the GLP-1 where it's a behavioral modification, so that you're on it for the 1 year, maybe 2 years, you get the weight loss, but then you've changed your behavior and you're able to maintain the weight loss without having to be on the GLP-1. So hopefully gaining savings that way, and with other comorbidities when you get the weight loss.
And are you seeing those programs?
I've seen people starting to try and put them in. Obviously they're brand new, so don't know how effective they will be.
What if we pivot off pharmacy? Because medical's still 75% of the spend, so let's not ignore that. What's going on there?
Yeah, let's say like I mentioned, large claims. Specifically, you've seen a lot cancer. Be a driver there. Mental health being a driver there when it comes to some large claim activity. And what are strategies around there? I know with Wellmark we've put a lot of programming. We have a whole new unit. We spent a whole podcast last time talking about it to help steer people to, the right providers to help them in that situation, whether that be virtual or in person. Trying to add some programming there or access, which is for mental health. One of the big things is that access.
Yeah, large claims bring volatility to every health plan, right? Whether it's self-funded or fully insured, and there's ways to manage that risk, case management and different programming. There's also ways to transfer that risk, and I would tell lots of employers that, hey, if you think the waters out there are a little choppy, or your business market is a little choppy, there's opportunity to guarantee your health plan spend by asking for a fully insured option. Yeah. My experience is Wellmark's stop loss is a very, very effective tool to take the rough edges off volatility. We work really hard to bring stability to stop loss pricing. Yeah. So don't forget about that either. Give that some consideration. Anything else on medical?
From my vantage point, one of the biggest strategies that we have and people have been utilizing a fair amount, and especially in the last few years, is around the network. We're very fortunate here in Iowa to have Wellmark Health Plan of Iowa network. Basically, that's our HMO and point of service options, and it's a way to maintain the same benefits, same cost share for members, but get an immediate hard savings in cost because of the better discounts that they can get through that network. Pretty much every client I've had, not pretty much, every client that we've moved to a WIPY plan has stayed on that plan.
Yeah, super broad provider panel, essentially the same as broad-based.
It's 100% of the hospitals in Iowa, plus it's 96% of the physicians compared to 98% on the PPO. Obviously, it's for employers that are based here in Iowa. For our national accounts, a lot of them are carving out that population in Iowa that onto those WIPY plans, and then they have the PPO access for the remainder of the group.
Okay. mental health has been mentioned already,
Yeah.
and there's been podcasts on that, and it's a topic nationally. What's going on out there with employers, and what are you talking to them that Wellmark can do to help?
I can start this off, Nick, and then if you want to, some of the biggest strategies is just communication, letting employees know what are those access points that they can utilize. Whether it's EAP, going out to Wellmark.com, we have a new landing page where there's an assessment that you can take, and if there is help that you need, you can go to our behavioral health case managers, and then they can point you into the right direction. It's making sure that they're aware of all the resources that they have available to them.
Yeah, I would say the two key themes that we've seen from the work groups that Wellmark has put together, access being, as we mentioned before, access is critical. There's an urgency generally to some of the challenges with mental health, right? So having the appropriate access, virtual or otherwise, and then navigation of care, right? Making sure right care at the right time, right? And so I think that's the critical piece there, is what we can do with that transition of care. So you mentioned EAP before. Because urgency matters, oftentimes employers have EAP plans in place, and so their members will, or their employees will reach out through those, and then they usually have a set number of visits that may be included. So then how can we go through that transition of care once those they've used those EAP visits that they've been allotted, and how they can transition into either staying with that provider or maybe transitioning to a different provider that can continue that service? How can we do that with the least amount of disruption? So there are all kinds of options that we're looking at to evaluate to smooth that process out.
I'm excited to bring that to the market. Hopefully we can do that soon.
Yeah. Employers are hungry for that, no doubt. Shifting gears one more time, let me fire one more question at you, Kareem, before I give it back to you.
All right.
There's been some talk about cancer.
Yes.
The concern there. Many would say and think that we're seeing that because of delayed care during the pandemic.
Yep. I think some of the data would say that.
Elaborate on that if you would.
Yeah, I think it's like what I was saying before. When you look at the data for most employers, and we see where large claims were 2, 3, 4 years ago, that level, a lot of them as going into 24, 25. Well, in between, in the 22, 23 year, there was dips in large claims. And now we're starting to see those rise again. And one of the biggest drivers is cancer, all different kinds of cancer. And we know within Iowa there has been studies that have shown we're one of the fastest rates of cancer growing in the nation. So I think those things, we're starting to get questions. What can we do to help there? Obviously, making sure people are going to get those screenings, catching it earlier, because what we're also seeing is some of the intensity of those are higher. So the basically the cost per service is at a higher level, which generally means maybe care was delayed or wasn't caught early enough. So there's more invasive things that need to happen.
Yeah. And I think the data would support that from the standpoint of nationally what we're seeing. Trend, where trend started. So pre-pandemic, we're now even seeing through the end of 2024 nationally trend at an 8% increase. So we've now surpassed what we saw prior to the pandemic, where we were roughly 5 to 6% trend year over year nationally, to now being upwards of 8. So supporting the fact that you're seeing a greater intensity of some of those diagnoses.
I appreciate you both being here with me. Is there any last things that either one of you want to say?
It's it's a tough business environment. It's Wellmark's desire to help Iowa and South Dakota-based businesses succeed, and that's our mission.
Yeah.
And we're committed to it. So let us know how we can help.
Well, thank you both again, and thank you to the audience for tuning in this episode of Health Matters. We hope you found the information valuable and insightful. If you enjoyed today's discussion, don't forget to subscribe to the Wellmark YouTube channel for more great content, and we'll see you next time. Thank you.